Hello, and welcome to the Georgia Baptist College of Nursing of Mercer University's Accelerated BSN Track program. I'm excited to show you around. Let's get started. This is our state-of-the-art learning lab, where students come to learn and practice skills such as hand hygiene, sterile procedures, and vital signs. They also have state-of-the-art equipment. We use high-fidelity simulators. We also offer mixed reality, which is a combination of virtual reality and real life. Students are able to practice real-life patient scenarios in a safe environment. Students also have an opportunity to practice independently during our open lab hours. Welcome to our classroom, where students take proctored exams. Exams are timed, and students take those exams on their personal laptop computers. We also have an accommodations room. Students are able to meet with faculty and staff via appointment in our office suite. Hey, future nurses, thank you so much for touring with me. I look forward to seeing you soon. For more information, you can contact us at 844-347-2108, or you can visit us at 3350 Riverwood Parkway Southeast, Suite 500, Atlanta, Georgia, or visit us online at absn.mercer.edu.
The biggest thing about Mercer's counselors and making sure that I made it to the start is that they followed up faithfully. If they said they were going to follow up in a month, they followed up in a month. One thing I can say about their counseling and admissions is that they did what they said they were going to do. And I really appreciated that, because when you're busy doing other things, you may forget to follow up, and they were already on it.
Mercer does a great job of supporting their students every step along the way. They have enrollment counselors that check in with you. They'll do the degree audit to see which prerequisites you have to take and which ones you don't have to take.
I saw an ad for Mercer come up and put in my information, and I got a call from my advisor about 2-3 days later. I was in contact with her for about 2 years before I actually applied into the program. She guided me through everything, helped me out finding a school to finish my prerequisites. It was very, very impressive. I applied a lot of other places and I did not hear back from most of them. There was one school in particular, they just kind of looked at you as a number, and every time I would try to email them and get a response, they would just send back a generated email, and that was all I got. And with Mercer, you know, I got a call from my advisor once a month, and then up at the end, right before application, she was emailing me once a week, calling me once a week, and just always following up and making sure that everything was going okay. When I took my TEAS exam, she called me the day of to tell me what a great job I did, and was just, you know, my cheerleader the whole time, and that was something I really appreciated.
I am Camille Pitts, and I am an ABSN student at Mercer University in Atlanta, Georgia. I was drawn to nursing because of having the ability to help someone, because I do feel like that's an internal need that I like to fulfill. And also, I'm just seeing people progress from being maybe ill to being well again. And I put like the top 4 or 5 nursing programs in the Atlanta area. I compared costs, length of program, what prerequisites were required, when the admission dates were, and the pass rate. One thing I liked about Mercer's program is that it was 12 months. So it was the shortest program out of all the Atlanta Accelerated BSN programs. And that was one of the biggest things for me, because I want to be sitting out of work for the shortest amount of time possible. But also, Mercer's nurses come highly recommended, and I wanted to be a part of the best. The ability to just be able to take the courses that you need prior to being admitted into your core coursework for the program is just amazing, in my opinion, that I can decide that I want to choose a different career for myself, and I can do it in a year. You can't beat that.
I'm Kate Kirkland, and I am a Mercer University ABSN student in Atlanta, Georgia. I found out about Mercer while I was still completing my first undergrad degree in public health. Nursing was always the plan for me, but I ended up getting pregnant with my son when I was finishing my first degree, and I started researching nursing schools around here. I saw an ad for Mercer come up and put in my information, and I got a call from my advisor. I was in contact with her for about 2 years before I actually applied into the program. It was very, very impressive. I applied a lot of other places and I did not hear back from most of them. And with Mercer, I got a call from my advisor once a month. Before application, she was emailing me once a week, calling me once a week, and just always following up and making sure that everything was going okay. When I took my TEAS exam, she called me the day of to tell me what a great job I did and was just, you know, my cheerleader the whole time, and that was something I really appreciated. The program is partially online and partially in person, and that works out very well with having kids and a life outside of school.
Looking at me, you could definitely see I am a non-traditional student, and that's okay. The first time I thought about pursuing a career in nursing was after I earned my undergrad, and my mother said, "You would make a good nurse," but I was like, nah. I want to do public health. I went and completed my master's in public health. So for 27 years, I worked in that arena. As I was working there, I realized there's this great connection between chronic disease, mental health, and coping skills. I want to have a holistic approach. I love what I did, but it was at the macro level. It was on the federal level. I want to do it one-on-one. The whole idea of preventing diseases is so much better than the curative piece. That's why I made the shift. I didn't retire and sit back and say, what am I going to do now? I put in place strategies so that I could retire early so that I could go into nursing. My goal is to be a mental health nurse practitioner. That's why I'm in nursing school, and that's why I know mothers are always right, because it took me 40 years to get here, but she was right. I saw Mercer, I looked into it, I knew they had an excellent program. From the moment I contacted Mercer, I just always felt supported. All of the professors, I just really enjoyed working with them. It was so nice to look and see people who look like me also teaching the courses, so that helped a lot. I would encourage any other non-traditional student, someone who is older, to come on and to try it.
Have our groups for lab or clinical. So I've had a chance to develop relationships and friendships with the people in my cohort. And we have a group me outside of our Canvas course, and we'll post things in the group me, tips, other study materials that others found helpful. And then sometimes after the exams, we talk about the exams and questions we may have missed. Because for me, I'm an auditory learner, and if I hear someone else explain it differently than how I may have read it in the book, that's helpful for me. It is asynchronous, and you have to be on top of your schedule. I'm an independent kind of person, so it's been fine for me to be at home studying alone sometimes.
I live an hour and 15 minutes away on a good day, but I like it because I can listen to my lectures, and sometimes my friend and I will call each other and we'll just keep throwing out questions throughout the time. And then there's people that live really close. So I just want to make it clear that it can work no matter what your circumstances are. It works if you don't live super close and you don't want to move into Atlanta.
One thing I liked about Mercer's program is that it was 12 months. So it was the shortest program out of all the accelerated BSN programs. And that was one of the biggest things for me, because if I'm going to be sitting out of work, then I want to be sitting out of work for the shortest amount of time possible.
We have many people with many backgrounds, different ages, coming from everywhere in this program, and I think that's special because it's not like your typical program where you do 4 years and you're done. My friend has twin babies that are 2, and she's able to get through it. If you're going to do this program, you need to be dedicated to this program. It's very important, but it is definitely achievable.
The program is partially online and partially in person, and that works out very well with having kids and a life outside of school. I just feel very humbled and impressed to be part of the oldest nursing school in the state of Georgia.
Looking at me, you can definitely see I am a non-traditional student, and that's okay. You already know how to navigate life. You're just going to apply that here. All of the professors, I just really enjoyed working with them. It was so nice to look and see people who look like me, also teaching the courses, so that helped a lot. I would encourage anyone, any other non-traditional student, someone who is older, to try it.
This program is for people who already have a degree, and we already did 4 years in college. So the ability to just be able to take the courses that you need prior to being admitted into your core coursework for the program is just amazing, in my opinion, that I can decide that I want to choose a different career for myself, and I can do it in a year. But also, Mercer's nurses come highly recommended, and I wanted to be a part of the best.
Mercer has a lot of simulation labs and practice situations for us, for pediatrics and for basically everything. We always have at least one simulation lab for our classes, and they give us instruction on things that are good to do with patients, and that's something that we also read about in textbooks, is things that we can do with patients, interventions that we can initiate ourselves without a prescription from the doctor, things that we can do to go the extra mile for the patient to help them be more comfortable.
The first semester, we did a lot of virtual labs and in-person labs, and then we had not as long of a day of clinicals. And then we moved into our second semester, and clinicals got longer, so 12 hours. Everybody was so sweet. They have lots of different resources for us, and so it just fit for me.
Looking at me, you can definitely see I am a non-traditional student, and that's okay. I did not find it difficult to do. You go through the prerequisites, and the prerequisites, it's a blended program. So you're going to learn to use the Canvas environment. Your professors are there to assist you with that. You already know how to navigate life. You're just going to apply that here. I would encourage anyone, any other non-traditional student, someone who is older, to come on and to try it.
Hello, and welcome to the Georgia Baptist College of Nursing of Mercer University's Accelerated BSN Track program. I'm excited to show you around. Let's get started. This is our state-of-the-art learning lab, where students come to learn and practice skills such as hand hygiene, sterile procedures, and vital signs. They also have state-of-the-art equipment. We use high-fidelity simulators. We also offer mixed reality, which is a combination of virtual reality and real life. Students are able to practice real-life patient scenarios in a safe environment. Students also have an opportunity to practice independently during our open lab hours. Welcome to our classroom where students take proctored exams. Exams are timed and students take those exams on their personal laptop computers. We also have an accommodations room. Students are able to meet with faculty and staff via appointment in our office suite. Hey, future nurses, thank you so much for touring with me. I look forward to seeing you soon. For more information, you can contact us at 844-347-2108, or you can visit us at 3350 Riverwood Parkway Southeast, Suite 500, Atlanta, Georgia, or visit us online at avsn.mercer.edu.
The biggest thing about Mercer's counselors and making sure that I made it to the start is that they followed up faithfully. If they said they were going to follow up in a month, they followed up in a month. One thing I can say about their counseling and admissions is that they did what they said they were going to do. And I really appreciated that, because when you're busy doing other things, you may forget to follow up, and they were already on it.
Mercer does a great job of supporting their students every step along the way. They have enrollment counselors that check in with you. They'll do the degree audit to see which prerequisites you have to take and which ones you don't have to take.
I saw an ad for Mercer come up and put in my information, and I got a call from my advisor about 2-3 days later. I was in contact with her for about 2 years before I actually
when you start the program, you would be seeing her when you are proctoring, or when you're taking your exams, she will be proctoring. We also have Miss Kayla Hudson, which some of you did get a tour from her. She is my senior enrollment counselor. We have Miss Alicia Adams, which is another one of my enrollment counselors. Say hello. We have Stephanie Robledo, which is my third enrollment counselor. And my final enrollment counselor is actually online. She's answering the questions for those that did attend virtually, and her name is Alexa. So now I'm going to introduce our academic success coach, Miss Syra Rogers.
Hello, everybody. My name is Syra Rogers. I'm going to be your academic success coach. While you're in the program, I'm here to help with resources, be that emotional support person. Student gave me this last semester. It's an emotional support pickle. They call me the program's auntie. So if you need anything like support, even if it's not academics, I'm here to help you talk through strategies, exam strategies, try to help with preparation for what's to come, and just be that support person. We'll do workshops along the way, as well as I'll be checking grades. So even if you don't reach out to me, I'm going to be reaching out to you just to see, hey, congratulations on that good grade you got, or hey, let's find a way that we can get to where you want to be in the class that you're in. But I'm going to be with you for the whole time. I'll be calling you before you even start. They're called pre-start calls, So I'll call and kind of touch base, make sure everything is connecting and you have that information that you need, and find those answers if you have any questions for you. But again, emotional support person. But I look forward to working with you guys in the future. Oh, hi. And now we have our Director of Nursing Services, Dr. Linda Toomer.
Thank you. Welcome. I am so excited to see all of you. You've just been introduced to me. My name is Linda Toomer. I am a nurse. I am the Director of Nursing Services myself, and I have a partner who is the academic side of me. We work in concert. I am the clinical arm of everything that you will be doing in clinical areas, in the lab. We work very closely together. So you will be seeing a lot of me. The course you've already found out is your lectures are remote. You'll be doing much of that online. But your clinical labs, where you get hands-on experience, where you learn to do the things that nurses do very well, you will be doing here on site. And your clinicals will be on site as well. And so you'll see a lot of me. Usually I'm not in a suit. I put this on for you all. But usually I have a lab coat on, and you'll see me in and out of your labs and watching you as you do skills, as you learn new skills, and giving you feedback on my experiences with the things that you're learning. So again, I just want to welcome you. I hope we see you in one of our cohorts very soon. We're always looking for great nurses. If you think you'll be an average nurse, we're not interested. We only want the great nurses. And you've got a whole team of people here to help you be successful. So hopefully we will see you soon. Okay. Who's next? I give back to you. Okay. Great. Okay, take a seat. You're not done yet. Okay.
All right, guys, next we are going to be doing our Pathways to Nursing panel. It's also going to be his question and answer. So obviously we have Dr. Toomer, and then we have our wonderful students that have gone through and are still going through the wonderful thing that you guys are about to sign up for. Sherelle, Sammy, and then Miss Jessica.
We got it.
Ooh, amazing.
All right, so if we can just take a couple minutes for every student to introduce themselves, and then we'll get started on the panel.
All right. Well, I'm Sherelle, last name Payne. I am graduating in May. Yay. My first degree was in biology.
I'm Sammy. I'm also graduating in May. My first degree was health science.
Hi, I'm Jessica. I'm second semester, so halfway through.
All right.
And my first degree was in biology.
All right, perfect. Next, for everyone, we want to obviously start out with Dr. Toomer, but we want you to go ahead and just tell us your path that you took for nursing. What did your pathway look like?
I have a long, winding road. I'm dating myself. For those of you that know that song, you recognize it. But anyway, I had a long, winding road. Can you hear? Can you hear me? Any better? Should I stand up? Is that any? Is it better? Where's that hand? How about now? Okay, great. I should have just scooted closer. Sorry about that. But I have to start off with my family secret. I'm from a large family. All of my siblings are MDs. I am the only RN. So that's my background. All I knew was healthcare when I grew up, and I knew I was going to do something in science. I didn't want to be a physician. Had such role models. I think it's curious that it was a nurse that all of my siblings in medical school actually used Barbara Bates as a textbook to learn how to do physical assessments. And Barbara Bates is a woman and a nurse. So that says it all. But I started out undergraduate, majored in chemistry, wasn't quite sure what I was going to do, floated around a little bit. My parents said, well, you've got to do something. So I had the original gap year, during which I worked at insurance company, Blue Cross Blue Shield. You all probably haven't heard of them. But it was an eye-opener for me. I learned a lot about uninsured and insured patients. I learned about Champus. I learned about things I didn't want to learn about. But I knew I had to do something. So I literally fell into a nursing program. And I say that because it has significance for you all. Here I was, a college graduate with 4 years degree in chemistry, which included some biology. And I literally walked into College of Nursing, visiting my sister one weekend, and they said, applications for nursing school due Friday, 1 week ahead. Can I do it? I applied, got in. That's how I knew I was supposed to be a nurse, because it takes more than a week and a half to get your things together. But I went to nursing school, got in. It was a BSN program. And it took me a whopping 3.5 years. Mind you, I already had a 4-year degree, but I literally started over and became a bachelor's degree nurse. From there, I decided I would get a master's, which I did, and then later on, much later on, a doctorate in nursing. I mention that because you have an opportunity to be a part of an accelerated BSN program. I didn't have that option. I wish I had. Things would have been a whole lot easier, because I would be focused, get that RN degree, and keep moving. But I didn't have that option. But nursing is the best choice I've ever made for a career. There's so much you can do in nursing. The sky is the limit, if you're a good nurse. I always like to throw that in there.
Okay. All right, I'll scooch this way. Okay. Can everyone hear me okay? All right. So for me, my pathway to nursing, I said that I got my first degree in psychology. I come from a background where I really thought I'd become a counselor. I love mental health, and I will advocate for that to the day that I die. But after I graduated, I was working with a nonprofit that was allowing me exposure to clinical counseling work, and it was too hard for me emotionally. And I started to realize that while my passions are there, I don't think that long term I could do it. And so I was 23, and I did not know what was next. And I ended up getting an office job, and I was working there for 2 years in sales. And I didn't at that time even know that I wanted to do healthcare, but I think being in sales and being in the office and working a 9 to 5, I was like, well, this won't work for me either. So what next? And then I ended up quitting my job and moving to the Dominican Republic to be with my grandma. And I was down there with her soul searching, trying to think about, all right, I love people, I love service, I need a job that's impactful. I can't just go to work and do something that shows no meaning in my community, but I don't want to be in an office, and I don't want a 9 to 5, and I like to be on the go. And it was actually my mom. She was listening to me vent about how I have all these things that I'm interested in, and I don't know my career. And she was like, Sherelle, why have you never thought of nursing? Now, my mom is a nurse. She's been a nurse for 35 years. And I think the reasons why I never considered it is because I just didn't want to copy her. But, because I'm stubborn. But when she said that, it was just this light bulb moment. And it was like, it's the service that I'm looking for. It's the impact that I'm looking for. It's the flexibility that I'm looking for. It's the go, go, go. I'm going to be an emergency nurse, so I'll be busy, you know? And I just feel like I'm so excited because I think I did find something that overlapped all of my passions and my personality, and that's hard to find. So when I figured out I wanted to go to nursing school, the real question was which school, which program? I already have a degree. At the time when I was looking at schools, I was then 26. I was like, I'm trying to start my career. And I heard that this program was 12 months. And I said, hey, that doesn't sound too bad. Accelerated is accelerated, so just be prepared if you're really thinking about it. You know, it's a 12-month program that's traditionally 2 years. So just putting that on your radar, but if you're looking to launch into a career change, you can do that here. And in 12 months, we're graduating. Sammy and I have job offers, and we're going to the companies we really want to work with. So it's doable.
Okay. Can you hear me? Yes. Okay. So my story is probably a lot shorter and a lot more simple. I have always wanted to be a nurse, and I've known that, you know, from growing up in school and stuff. And I had to, originally I was a nursing major, but I had some hiccups when I started school originally, and so I did have to, you know, change my career path and take a different route a little bit. And as I was graduating, like coming to the end of my health science degree, I started talking to an enrollment counselor for Mercer, and we just kind of stayed in touch and we talked through everything, and I was here. So like my goal was to always be a nurse, and I didn't get to do it traditionally, but I'm here and I made it.
So same like Sammy, mine's short as well. So I went to Georgia State with a biology degree. I knew I always wanted to do medicine. And then after I graduated, I took kind of like a 2-year break, tried to apply to certain things, but it didn't work out. So one day I just tried nursing. Let's try it. And I heard about the accelerated program. So I applied. I was like, if it's meant to be, you know, it'll work out. I'll get accepted. So I got accepted, and whilst, you know, I'm going through this process, I realized, like, I'm in love with it. Like, I feel like this is where I'm supposed to be. So I'm excited for it, for sure. Yep.
All right, perfect. Next, I want each of you to give the best piece of advice that you wish someone would have told you while you were going through the admissions process, getting into starting the program.
Okay, I'll go. I would say taking one step at a time. For me personally, I'm that type of person where it's like I'm always thinking ahead. You know, I get so overwhelmed. But when I change my mindset of, you know, one step at a time, celebrating every milestone, it's easier. You start to digest it more better. So that's one advice I would say. Yeah.
I would say also to make sure you're organized. I have always been a super organized person, but organization and accelerated program is not the organization that you're used to. Like, it is definitely up there. So staying organized so that way you have time to celebrate your wins. Like, you need to pencil in time for yourself also.
I think the biggest piece of advice I would give, and I'm glad I didn't miss this because I'm surrounded by people that have taught me this in the program, so I don't have to have any regrets, but like, maximize your connections. Maximize your classmates, because those could be people that could refer you to a hospital you weren't able to get into in the future because they got the job. Maximize your coaches because you have so much support here. So if you're struggling, don't suffer in silence. And the biggest thing, when you go to clinicals, you're interviewing. I have a job that I have because my clinical instructor in fundamentals, which is the first clinical rotation you'll get, was like a contact at the hospital I wanted to work at, and the manager. You're always on. And I'm so grateful that like early on I peeped that and I tapped into that, but there's a lot of people that I think at the end start to realize they should have done that. And it's a 12-month program. It moves quick. So if you don't get it while you have it, it's gone. The opportunity's gone.
Very good advice, and I can just say ditto to everything that they've said. Even though my career was different, nursing is a small world. Nurses know nurses.
Yeah.
We connect. That's what we do, regardless of the kind of nurse you are. We connect. We support each other. But I do want to say about this program, it's a full-time commitment. We're asking for a lot from you, but we're giving you a lot as well. So be aware that we want it all. We want 100% for this year, and you'll need it, and you won't regret it at the end.
Yeah.
Perfect. All right. Do we have questions from the crowd? Go ahead.
Jobs like that, see if they do, especially if you're not from here, you don't, I come all the way from Michigan, so I can't just go where I'm gonna go. I have to live. So with that, is the accelerator program something a person like that should do, or can we work, or is it possible to work and still go through it?
Okay, so the prospective student's question was, is it possible to work in this type of program?
So I work. I am a substitute teacher, and I also am a server at an Italian restaurant close to my house. I don't do them all the time or at the same time. So I kind of go off, like I started in May. So in the summer, obviously the school is not open, so I was serving. It's hard. And like I said, you really got to stay organized, and you have to choose. You still have to prioritize school. And it's hard, but you can do it. And then there's breaks. I try to, like we have breaks in between classes, so I try to make sure that I'm working during those breaks. And, it's doable. You can do it. Don't let that deter you.
Yeah, I also work part-time. Luckily, I have a job where it's a little bit flexible. So maybe sometimes I'll do like once or twice a week, but majority is this program. Like your education comes first. So, yeah.
And I would like to add, because in our cohort, we have a lot of people that could not quit their jobs. So I can really empathize with your situation, but I'm going to give more of like a warning. Should you work in this program, if you don't have to, don't. This is a job. This is your job. It's unpaid, unfortunately, but like you have to be available for it. But can you work in this program? I'm not going to make a blanket statement of yes, you can. It's individual. It's the student themselves. You have to be so good at time management, organization, and sacrificing, because if you have a job, then that's all of the other things that you could have been doing with that time. That's your sleep, that's your social life, that's your self-care. You cannot do it all in this program. So if you have to work, just realize that's now something that's taking time from something else, and that thing that it's taken from especially is the program. But it is doable. We have people that have worked in this entire 12 months, and they've not had to quit. So, but those students are on it. You got to be on it.
So of course I'm the senior nurse here, so my answer is no. I'm just going to be honest with you. I think it has a lot to do with you. If you have a background in biology, then yes, you are more likely to be able to handle a part-time job. Notice I said part-time. Full-time is out. And part-time has to be very, very flexible. But I don't recommend it personally for the program. Definitely not in the beginning as you're trying to figure out whether you can work. So, part of adulting is making those difficult decisions. If you have to work full-time, you may want to consider, I don't want to talk you out of the program, but you may want to consider something else. Another route to being a registered nurse. This is very aggressive, very, it requires a lot of time. And I'll be honest with you, I watch my colleague. I told you there's a partnership. I am a partner with our director of the program. She's over the academics. And there is Tabitha in here? Hey, Tabitha, stand up and share, because I was going to say, yeah, it's very painful to see a student with a lot of potential who's not successful because they haven't put the time in. And they can't put the time in because they're struggling with meeting obligations. Mm-hmm. Tabitha, please, comment, anything. Mm-hmm. Mm-hmm.
So you can find someone that is able to manage family and work and, other things. You can find some students who really struggle even when they are living at home and don't have a mortgage and don't have a job. It really is just, there's not a one size fits all. We will support you, any way we can, but it's knowing you and being honest with what you can do. I would say, if at all possible, pull as far back from your commitments in the beginning till you kind of get your feet under you. And then you can always add in an extra shift, an extra day at work, once you kind of get things established. But it is such a fast program that if you get behind, then it's really hard to catch up. So that's what I would say. Just take a really, and any of us will talk about with you what your life looks like and what your commitments are and that kind of thing, to talk realistic about your specific circumstances. We do get that it's not, nobody's handing out free money. So we all have commitments, but you also don't want to have unrealistic expectations coming in. So,
all right, perfect. Next question.
My question is more geared towards, I know that this program has a partnership with Wellstar, and for your clinical and for your is there the possibility of doing preceptor with someone other than Wellstar?
The question is there a possibility to do preceptor with someone other than Wellstar, or a company other than Wellstar?
not at this time.
But, and remember, your preceptorship is in the end, is your last clinical, quote unquote. Mm-hmm. And what we try to do is pair you with someone who has the experience or in the area that you're interested in. We try to give you your preference. And very often what students will find is, even though we pair you with a Wellstar preceptor, they've worked at other hospitals and can give you feedback, mm-hmm. And good comments about, good suggestions about getting involved in that field of nursing. So even though we use WellStar, yeah.
And I'd like to add something. I'm not saying that everyone needs to explore this option, but there are things called externships.
Yes.
If you know that there's a hospital that's on your radar that we don't go to, they probably have an externship program that is specifically for students in a nursing degree working towards a BSN. You can then go and get a job in a hospital, and it's kind of like practicum, but you're paid. I'm not saying that everyone can keep up with this because, again, it's a job in this program, but I was able to get an externship, and some of my other classmates were able to get externships with hospitals outside of WellStar to expose us to these organizations so that we could have ins for jobs. So if you are the kind of student that can keep up with adding a job to your plate and you want it to make that job practical for future career opportunities, you could look at that as well. Those applications are not easy to come by, and I will say that because it's a fast program, 12 months, candidates like us aren't their top choices, because by the time we start the externship, we're almost graduating. We're almost graduating. So, but keep your eyes peeled for it. If you already know, I'm coming into this, I know where I want to work, I'm interested in a certain field, they probably have an externship for that, and maybe that's something you could add outside of WellStar to get that exposure you're looking for. But again, it's a job, so be careful.
Perfect.
Great point.
Yes.
Just to clarify, for the clinical rotations, are they through on the weekends or are they through the week?
So the question is, when are the clinical rotations?
Or do you want to answer?
Yeah, clinical rotations, they are, well, mostly, they should be on weekends.
They're primarily on
Primarily,
Sunday.
mostly.
Yeah. But we do some weekdays.
Mm-hmm. Yeah, Mondays and Tuesdays too as well.
Mm-hmm. Yeah, and they break you apart in groups, so certain groups go certain days, but mostly on weekends.
We don't break you apart.
No, like
we separate.
Divide.
I'm teasing. Just adding what.
Perfect. Yes.
My question is, I guess that's two. You guys are talking about the clinical, what clinical area specialties are you guys focus on? And the cohort size of what is the average size for
So the first question was what areas of the clinical specialties, and then the cohort sizes.
Well, for the first year, for the first year students, first semester students, we try to focus on the med-surg areas and the general medicine areas, medical and surgical areas. As you advance in the program, we start branching out to specialty units, specialty services. And then, of course, until you get to your preceptor level, and then because we want you to have good foundational skills. So that's our goal. We want to put you somewhere where you can do more than just vital signs. We want you to be able to do patient assessment. We want you to see procedures that you would potentially be doing as a nurse, and some exciting things as well. Even though you can't do it, you can watch, and as you advance, you participate.
Yeah. And we can even be a little bit more specific about the specific rotations that we got to see. So med-surg will be a big one. You'll get like almost 100 hours before your practicum in med-surg. I'd say more like 75. I might 100's a little too much. And then you'll get to see peds, labor and delivery, and when you go to women's services, you can see labor and delivery, NICU, or mother baby, because they're all clustered together. We got to see ICU and critical care or step-down units. And then once you get to your practicum, you get to choose your top 3. And then they'll try to fulfill your first or your second if they can. I know that we have emergency, we have NICU, we have peds, we have L&D, mother baby, ICU, and critical care. Some people wanted to do OR, so they're going to be in general surgery services. So it's not really until the very, very end where you get to be more creative with what you're seeing. But the majority of your time you will be seeing med-surg, because this program is training you to be a general nurse, and then you can take those skills and go do something else after you graduate.
And then we also go to mental health. Yeah. And then for our population class, you either go to hospice or employee health. Yes.
Yeah.
I forgot about
So it's a good range.
You see a lot.
Yeah. And then, what was your other question?
The cohort size for average size.
Oh, yeah.
So before we get to that, maybe Erica can comment on that, but we also use CHOA for
Oh, yeah.
pediatrics.
Yes.
So we use WellStar, but we also use CHOA for peds.
And for cohort size, on average, it's about 45 to 50 students per start. But it does vary depending on the time of year. The question is, what pushed you to get to where you are, and why didn't you stop?
Okay. What pushed me? Family, people around me, self-motivation, that's what pushed me. Self-determination, wanting to get to a place that I wanted to see myself. So yeah, that's what pushed me.
I would say also making friends in your cohort. I think they're so important. You need to really get to know your classmates. You need to study with them. You need to have a group message. You need to cry together. Like, do all of the things with these people because you're here for a whole year. And, like, really, they become your best friends. Like, you talk about that, like, oh, nursing school best friends, and now you go on trips together. I know you guys have seen the TikToks. Like, it's so real.
You're travel nurses now.
Exactly.
No, seriously, I will second what Sammy said, because what we are doing in this ABSN program here at Mercer, no other program understands except for people in this program. It is so unique because of that hybrid piece as well. So, like, if you want someone to bond with that gets it, they're the people in this room, or whenever you start, the people in your orientation room. Because you're going to feel like you're on an island. And no one, your family member won't get it, and they won't know why you're crying. But, like, like your classmates will, you know? But for me, I think what got me this far is how much I have paid to be here. I am not wasting my money. I said, first of all, I said 12 months because that's all I had in me. And if I fail a class, that delays that. So I have to get in and I have to get out. I only have 12 months in me. And the investment piece, I put money forward, and I can only get that money back if I graduate. So I see it as an investment. And I think that when you realize that, what's that, I feel like that's why so many of us work so hard, because we sacrifice so much to be in this program, not just financially, but we don't get to be with our friends and family like we want to. It's a very demanding year. So I'm not going to prolong that any longer than I have to, you know? But yeah, that's what gets me through.
But I'll tell you, and Tabitha, we're a different generation nurses, but things haven't changed. Nursing isn't for cowards. It's not an easy job. If somebody told you this was a cushy job and you get paid a lot of money, it's not true. The money they pay you is never enough for what you do and what you give your patients. And I like to remind students that it is a privilege to be able to care for someone at their most vulnerable time. They're not the nicest patients. They're hurting. You've got issues. You've got problems you brought to work. It's not about you. It's about your patients. So we sacrifice and we pour into our patients. And so when Tabitha and I think about you all, and we think about what we do here at this center, we think about what kind of nurse would we want to care for us. And that's what we want you to know. We don't want a nurse that will take shortcuts. We want a nurse that really understands what's going on. And there are some secrets that you learn in nursing. You learn that sometimes you have to say to the resident physician, have we thought about this? Because we're patient advocates. So sometimes we have to stand up for our patients. That means you need to understand everything that the physician understands, and you have to be able to communicate it to your patients. So, I gave you all my background. I know medicine, but I didn't want medicine. I wanted to be a nurse. And it is a privilege, and we take our jobs very seriously. So we're not going to let you half step. You leave this program, we want to be able to say, yes, she went to the Mercer ABSN program. Have us say anything? I don't know.
All right, perfect. Other questions? Yeah. So the question was if there were any types of scholarships, and your enrollment counselors, we do have like a financial guide that we can send you, which does have a couple links for different scholarships that may be available. So we can definitely get that sent out to you. Yeah, what does an academic year typically look like? When do the labs start? When does it all start?
Well,
feels like so long ago.
I'll start it off this way. Every 8 weeks is a new session.
Okay.
So part of the reason why it's so fast paced is because by the time you get the handle of like, oh, I know what I'm doing and I know how this class works, it's over. Guess what? Now you got a new class and you have to like start over. So I guess we can break it down by like how it plays out to answer your question.
Yeah, so first semester you have adult health. I'm sorry.
Fundamentals
and health assessment. Yes, sorry. So I think you start like labs honestly the second week.
Immediately.
First week?
Yeah.
Okay.
Yeah. So you go straight into it.
Next day we start lab.
Yeah.
Next day or 2 days later,
Yeah.
same week.
So you really hit the ground running every 8 weeks.
But for clinicals, because you're still, you have to pass a certain amount of like skills checkoffs before you are like cleared to go into the hospitals. And so you have to do all of your validations and pass those before you can start clinicals. So only in the first session is it like a month, like 4 weeks before you go to your first clinical site. But after that, typically when you get your labs and your clinicals, you can have clinicals start week 2, week 3. And some sessions, you'll have it every week. Others, like when you're in like the specialty classes, you might have clusters where it's like this week is designated to my peds rotation, I'll go there for 2 weeks, and then this week is designated to L&D, I'll go there for 3 weeks, and it's different. So yeah.
Yes.
Pretty much.
Several times.
I will say too, as the program progresses, there's less stuff. Your first, I would say 14, 16 weeks, your first semester will be the most hands-on and intense. You have the most labs that will be in the program, and you have the most exams that will be in the program. After you get into semester 2, it starts to kind of wean off a little bit, less labs, and it's more intentional when you're here. And you'll have still exams, but not as many as you will that first session. So the intensity, go ahead and be prepared. That first couple months, it's going to be a lot of being here. And then it will wean off and you'll be more probably in clinicals than anything else. Yeah.
Well, yeah.
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 Yes.
Yes.
Yes, free parking. The question is about retention.
Depends on if they're working. No, I'm teasing. It just depends. I've only been here 2 semesters. So what I have seen, it just depends. It depends. Surely we lose students. Sure, we have students who decide, you know what, I thought this nursing was my bag, but it's not. We have students who academically struggle. We have students who probably need to be in a longer, not an accelerated program. So we do lose students for various reasons. And it's not a reflection always on the individual student. Sometimes it's
And in general, I feel like nursing programs, 100% retention isn't anywhere. These are hard, whether it's accelerated or traditional, hybrid, or all on site. You'll hear that, though. You know, you're not going to start and finish with everyone, and that's why you have to know your why. Why are you here? Did you really do the research to make sure this is a good fit for you? Are you prepared for the work? And if so, then you can be successful. You can be very successful.
And are you ready to put in the time? Because it takes time. Some people organize themselves differently. So it helps if you know how you learn. Do you have to read, then write it? If so, it might take you a little longer. You may need to spend more time. If you're a visual learner, you may learn it faster. But again, the outcome is you've got to understand what you're reading and learning. That's the outcome we need. We need you to understand it and be able to apply it. Good questions.
Would y'all agree that someone coming from a science background would be more ideal for the ABSN program? Because I come from acting and communication.
Oh, we love that. Welcome. One of our...
I always think in the fact I like science.
Yeah.
Did that match?
Yeah. Somebody in our cohort that's graduating in May, he was a theater major, and he had to stop performing because of COVID, and, you know, things got harder for him, so he came into nursing. And like I said, he's about to graduate, so I think it really is individualized. It's not so much about what you already know, but it's how bad do you want to be a nurse and how bad do you want to finish.
I completely agree. Yeah. When I was in orientation, one of the questions I asked the panel was, literally, in 12 months, this program make me a nurse successfully and I can survive? And I know nothing. Is that okay? Like, should I be coming here? And they all looked at me. They were all from different backgrounds, and it's not about what you already know. In fact, I feel like you're at an advantage if you know nothing. Right. You're not bringing in bad habits. Yeah. Some of the people that come in with like backgrounds in medicine think they know nursing, think they know the nursing process. They don't. Yeah. And then it shows up on the exams because they're going off of what they think is right and not what the book says.
Yes.
So it's okay if you know nothing. I promise I didn't know anything either.
Yeah.
Yeah, because for me, I come from a medical background with my major, and also like I was a medical assistant. So there's a lot of things you're like, wait, I don't remember this. So you kind of have to unlearn a little bit. Yeah, for sure.
Yep. Yeah. And some majors, some undergraduate majors are it's memorization based. And my undergraduate degree was chemistry. It's very much memorization. But nursing is not like that. It's memorization and application. So, yeah. And you'll have some rousing conversations with your colleagues on issues. And that's what we want in nursing. So.
All right. Any other questions?
Is another?
Yeah.
Yeah. Go ahead.
Good morning.
Yeah, let's go.
I want to get to the most important part. How are you all paying for it? Because like we are going through like undergraduate, you know, you run out of money. I'm about to run out of money from an undergraduate. So what? I know the scholarship stuff, but you all take it out loans. Like where are you getting loans from? You guys have good credit.
The question is how are they paying for the program? Like how are you making ends meet?
I'll start. Fortunately, I do live at home, so that helps. But I do work. I pay a little bit out of pocket. I have some, like the nursing student loan that Mercer offers, and then, like FAFSA and stuff. So I try to grab as much as I can, and then if I can get a private loan, great. If I couldn't, then I'll pay out of pocket, and then that's when I'm working more. So, I mean, I do think it's kind of individualized, but they will help you. Please, go to them for help. I am constantly hello, I have more questions. Even now, for various things, but they're here to help you, and be able to see like what you can and can't do and where you can apply for stuff and whatnot.
Yeah, definitely use your resources. You know, the loans, scholarships, whatever you can do. And they also have payment plans as well. So depending on how much the tuition is that semester, can break that apart and pay it every month. So they offer that as well. Yeah.
I think, I don't know your situation. I don't know anyone's situation in here. So I can't make statements that are, you know, applicable to everyone. I will say, as much as you can rely on support from others, you're going to need it. So loans is like how I'm paying for my stuff. FAFSA, you know, unsubsidized and subsidized gives you a little bit, but it doesn't cover the full cost. So you will need to come up with the rest. Some people have it like that and they're able to pay out of pocket. I'm not one of those people. Okay, so I'm relying on private loans. And I actually found the loans that I have because Mercer has a resource, I couldn't tell you what it's called, that you have to like log in and put in this information, and it teaches you, one, how loans work, so you can understand how the payback process works, what interest rate means, what does it mean when they say these kinds of, there's a lot of like legal writings in these contracts, and if that intimidates you, they break it down so you can know what you're signing. I loved that resource. And then at the end of it, it introduces you to all of the loans or lenders that people have used previously. And it's a lot of different vendors. And it'll show you, you know, if this is a fixed rate or a variable rate, what's the interest rate? You know, is it for specific master's programs only, or is it for undergraduate? This is considered an undergraduate degree because it's a bachelor's. So you'll have access to every vendor and you can compare. Me and my mom sat down, we were like, well, we can't use this one, this interest rate is too high, or it's not fixed, we need a fixed rate because we don't want to be chasing that interest. And so there's a resource that they send you, it's a link that you can click on so you can see all of that and figure out what's the best lender for you. But you're going to go in debt. You're going to go in debt if you come to this program, but see it as an investment. Any program, honestly. Yeah. You're going to, because it's a second bachelor's. Everyone in this room, if you're considering an ABSN, you already have a degree. You used your money already. Hope, scholarships, that's all gone. So you have to be prepared to make this an investment. Yeah, and if you see it as an investment, it will be worth it, and you can make your money back. But, yeah.
And that resource is called Sparrow, and yeah, it's amazing. All of your enrollment counselors have that link, so all you have to do is just let your enrollment counselor know. You either shoot them an email or give them a call tomorrow, let them know that you want that link for Sparrow, because it does allow you to just see what your options are, and without any, no strings attached, you just need to see what is even out there. And it helps kind of alleviate that stress of having to go to a bunch of different websites because it's all right in front of you.
Yeah,
for sure. We have a specific site through Mercer's financial planning department that goes straight through to Sparrow. So it's through, like, Sparrow is a national company, but Mercer, we have a partnership with that, so you can actually use the Sparrow resources with Mercer information. So, yeah. Diego's question was, how do you get help if you're sitting at home trying to do some type of assignment or take a test and you don't know what to do? Who do you reach out to?
So like I said, I'm a resource user, so I'm always emailing my professors. My first semester, I was on Zoom with my professors like once a week. Like, hey, I'm reading this doesn't make sense. We'll go over my test, like how I felt about my test, what I feel like I could have done better. So your professors are there for you 100%. There are no lectures, so they give you like a learning guide to help you read through the textbook. So then you will have questions. So definitely reach out to your professors. Like I said, we have a study group that we made early on. So if I have a quick question, I'll ask in there. If none of us know the answer, then we'll go to the professors.
Readings, videos, other learning activities to help hone your knowledge on that topic.
Yeah.
And then, of course, you've got labs where hopefully we can bring some concepts together for you as well.
For sure.
Yeah. You're going to become a brilliant Google master by the end of this program, because there's so much on the internet that's free that you don't have to pay for. Like she said, YouTube videos and so many people that are already nurses that break down concepts, because you're going to have the hardest session, quote unquote, that we always warn you guys about is fundamentals, because it is the introduction to how to think like a nurse. And unless you come from already being a nurse, it's like learning a new language. And so there are so many people that break it down for you as, why do we think like this? And why is this important? And what does this mean? And how does it like show up in practice? So that way you can start to get a handle on it, so it's not so intimidating. Because once you learn the foundations, they don't change. But it takes a second to get your footing on, why are we looking at it this way? And why do we ask the questions that we ask? And why am I thinking this way? So that's a learning curve that you'll get a hang of. And your professors are former nurses. All of them have practiced in the bedside before. So they know why we're learning the way we're learning.
Yeah, and videos are inside your learning module.
They are.
You know, you don't have to go to YouTube necessarily, but you have them in your learning module as well. Okay, we do have state-of-the-art. We use state-of-the-art training modules that are internet-based, so you'll have full access to that. And, you know, some people just need to ask, and they need somebody to say, this is how you need to look at that, or you're heading in the right direction. Focus on this and the why about this. And that doesn't change. That personal, that's what's so great about the program. You have everything you need, but you also have people that you can talk to. But if you don't say anything, we don't know that you need help.
Right.
So that's why your faculty are there, and they email you constantly. They give you a lot of information, and you should email them as well.
Yeah.
They have, yeah.
So I know this is a 12-month program, but if life starts lifing, for instance, and you realize I need to extend this beyond 12 months, or I might need to take a break or a pause, or I can come back to whatever circumstance that may drive for that, is that possible during this program? Is there flexibility in situations like that to extend or go beyond 12 months?
The question is if there's a possibility to extend it past the 12 months if life gets too much.
I think Tabitha might be a good person to answer that.
It kind of depends on the circumstances and the timing. We don't generally recommend that, because when you lose momentum, what we've seen is when students lose momentum, it is really hard to get it back. So we certainly could have conversations about particular circumstances. You know, we're not gonna, things come up. But there are different, when you get off track, we call that being off track. There are different things, like you have to redo, there's logistical things that have to be done. You have to do validations again, or you have to redo your background check and drug screen. Like there's lots of little pieces like that, that we don't have like a part-time ABSN program and a full-time ABSN program. So I would say try to, you know, if you know something is coming up that you probably want to defer entry altogether, and then wait until you can fully concentrate on starting the program and going all the way through.
Yeah. Like you want to get married and you want to take a month honeymoon. Let's plan that before or after the program, not during. Yeah. So.
We have a question about more information about the externship.
What would you like to know?
Ms. Payne.
You have to be okay. Let me tell you what I know. So first and foremost, most externship programs do require that you have already completed fundamentals. For us, that's in 8 weeks. For other programs, that's usually a whole semester. So that's the criteria number one. They want to see that you've also completed at least one of your clinical rotations, because when you're an extern, you're going to be on the floor with a nurse, working with a nurse. They want to make sure that you have at least that fundamental foundation of patient care, because if not, then you're kind of behind when you start working with this nurse that's trying to train you more. For my experience, I did not start my externship until December. I started in May. I was like 65% done with this program. It just so happened that my start date and orientation fell during our December break, so I was able to get all of that done, and it did not conflict with clinicals, classwork, exams, because at the end of the day, an externship is not Mercer. Mercer comes first, and if you have an externship and it's getting you behind or making you unavailable for clinicals, that could lead to failure. So I feel like you have to make sure that it lines up, and that's a conversation that's so individualized. And I know that applications for different hospitals open at different times. The one that I was interested in, I'm a summer start, so a lot of times they start in spring, which is like January, February, or fall, which is like November, October. And so it was hard for me to find something, but I was very, I have a lot of grit. So I didn't want the opportunity to pass. But for a lot of my classmates, they were unsuccessful in getting an externship just because of where we fall in the timeline of those start dates. And it is very hard to be, 7 months done with a 12-month program and just starting an externship. Usually those run for a year. So they like to see that you're still early in the program. But that's why I warn you guys, because I don't think I could have been an extern in the first 6 months of this program. I only have been successful as an extern because I've done 7 months and I know how to keep up with the curriculum. And I'm also in the stages of the program where there are less labs and there's less stuff on site, so I can go and work a shift. So it's like, yeah, they're really cool and like look out for them, but like, good luck, one of those kind of things.
And I was going to comment something similar. The extern programs, they will vary by hospital.
Yeah.
But they're designed to put nursing students in a clinical environment, have them work. They usually have minimal hours that they expect you to work.
It just depends.
So that you can, it depends on the organization, but they want something from you as well. They want to enculturate you into their hospital, give you enough experience so that you understand how things work here and hopefully want to come to work here. That's the purpose of them. It's not necessarily designed for the accelerated BSN program in 1 year. I'm going to be honest with you. They're designed for the traditional nursing program. Now, that being said, yes, once you get 3/4 of the way through, that might be the part-time job that you pick up depending on your organization, the organization that's offering the extern, if they even have an extern start then. So, there are other things you can do. You can work as a PCT or a nursing assistant, if, part-time on a PRN basis. There are other options. But your first goal, you've got to keep your eye on the prize, is to get through the program. You've got to see that light at the end of the tunnel before you start veering off. And sometimes that's really hard. Hence the conversation we're having about resources and support. Yes.
So it is $61,773, and then for all three fees of all the terms put together, it is $2,805. But that is not including books, that's not including scrubs or any other additional items like that. So that is literally just tuition and fees for the program itself.
But I will add, like, with scrubs and sometimes shoes, if you're interested in that. The ABSN Facebook page, people will sometimes give away their scrubs or, sell them for cheaper. And that's helpful. Let's see, your stethoscope, I would buy a cheap one off Amazon. I got mine for like $40 off Amazon. I don't think you need a really expensive one because everything sounds the same in nursing school. Like,
when you're starting, it's hard to
later on, get the Littman, but I would say right now stick with something from Amazon.
And get Skechers, not Hokas. Like, you can save your money in so many ways,
Yes, for sure. What?
I will say for books are the most expensive at the beginning because sometimes, like for instance, you'll take Adult Health 1, Adult Health 2, Pharm 1, Pharm 2. Guess what? Same book in both classes. So I didn't have to buy books this semester because I already bought them when I took Adult Health 1 and Pharm 1. And then the book for peds and labor and delivery is the same book, so that's only one. But at the beginning, you're in all new classes that don't have repeats. So you'll be buying a book for funds, a book for health assessment, a book for population health, and a book for mental health. That will be your most expensive semester. So think of it that way. It gets better the deeper you get in. It's like you almost start to save money towards the end if you think about it that way.
Girl math.
Girl math.
All right, perfect. I think we're going to take one more question. What do you got, Diego? How do you pass the T's?
ATI.
Yeah. I had a book. I went to the T's Mercer workshop thing that they had. And then if you go to that, they send you a book. And I read the book. I did the practice questions. And yeah, and I'd say carry that on through nursing school. Read the book and do the practice questions, and everything will be great.
I will say someone recommended to me, for your first attempt, don't do any studying. Just practice. Let me reiterate that. Not the real deal. Take a practice test with no former studying. See what you get. Because that will show you raw what you already know based on your prerequisites. Also, don't start practicing and doing the T's until you're done with prereqs. Because the material on the T's, especially for that science portion, is your human anatomy and physiology. If you haven't finished those classes, you're probably not going to do well in that section, okay? So once you finish your prereqs, take a practice test, see how you do, and you'll see your weaker subjects. For me, I did excellent in English and language arts because I come from a liberal arts background, but I failed math. So I had to go and take my time through the math portion of the ATI. ATI has a book, but they also have a website. I think it was like $80 to log in and have everything electronically. And I loved the ebook because you can take it on the go. If you have a laptop, you don't have to haul around this big book. You can just do it while you're sitting in an office or whatever. And I would work through all the math. I ended up getting a 100 on the math section in the T's. That's how excellent that resource is. I mean, if you practice it, it's designed because ATI makes the T's test. So if you're using their resources for practice, you're already exposing yourself to how they ask the questions. And it can really get you a great score first attempt. But I would say just take it raw, see what you're bad at, study those sections first, get really good in those sections, and then go to your other areas that are maybe like in the 80s, not naturally. See if you can get them up to 90s. Take another practice test. If you pass that second or third practice test, you're ready. Go take it.
Perfect. All right. Well, thank you to the panel very, very much for all those awesome answers. Next, if you have not spoken to your enrollment counselor for a while, or you want to set up an appointment with an enrollment counselor, I have my team back in the student lounge, so you can go back in there. They're each set up at a different table. Just walk up to a table. We will get you scheduled, and we'll get you taken care of. Alrighty, thank you guys so much.
Hello, and welcome to the Georgia Baptist College of Nursing of Mercer University's Accelerated BSN Track Program. I'm excited to show you around. Let's get started. This is our state-of-the-art learning lab, where students come to learn and practice skills such as hand hygiene, sterile procedures, and vital signs. They also have state-of-the-art equipment. We use high-fidelity simulators. We also offer mixed reality, which is a combination of virtual reality and real life. Students are able to practice real-life patient scenarios in a safe environment. Students also have an opportunity to practice independently during our open lab hours. Welcome to our classroom, where students take proctored exams. Exams are timed, and students take those exams on their personal laptop computers. We also have an accommodations room. Students are able to meet with faculty and staff via appointment in our office suite. Hey, future nurses, thank you so much for touring with me. I look forward to seeing you soon. For more information, you can contact us at 844-347-2108, or you can visit us at 3350 Riverwood Parkway Southeast, Suite 500, Atlanta, Georgia, or visit us online at avsn.mercer.edu.
The biggest thing about Mercer's counselors and making sure that I made it to the start is that they followed up faithfully. If they said they were going to follow up in a month, they followed up in a month. One thing I can say about their counseling and admissions is that they did what they said they were going to do. And I really appreciated that, because when you're busy doing other things, you may forget to follow up, and they were already on it.
Mercer does a great job of supporting their students every step along the way. They have enrollment counselors that check in with you. They'll do the degree audit to see which prerequisites you have to take and which ones you don't have to take.
I saw an ad for Mercer come up and put in my information, and I got a call from my advisor about 2-3 days later. I was in contact with her for about 2 years before I actually applied into the program. She guided me through everything, helped me out finding a school to finish my prerequisites. It was very, very impressive. I applied a lot of other places and I did not hear back from most of them. There was one school in particular, they just kind of looked at you as a number, and every time I would try to email them and get a response, they would just send back a generated email, and that was all I got. And with Mercer, you know, I got a call from my advisor once a month, and then up at the end, right before application, she was emailing me once a week, calling me once a week, and just always following up and making sure that everything was going okay. When I took my TEAS exam, she called me the day of to tell me what a great job I did, and was just, you know, my cheerleader the whole time, and that was something I really appreciated.
I am Camille Pitts, and I am an ABSN student at Mercer University in Atlanta, Georgia. I was drawn to nursing because of having the ability to help someone, because I do feel like that's an internal need that I like to fulfill. And also just seeing people progress from being maybe ill to being well again. And I put like this top 4 or 5 nursing programs in the Atlanta area. I compared costs, length of program, what prerequisites were required, when the admission dates were, and the pass rate. One thing I liked about Mercer's program is that it was 12 months. So it was the shortest program out of all the Atlanta Accelerated BSN programs. And that was one of the biggest things for me, because I want to be sitting out of work for the shortest amount of time possible. But also, Mercer's nurses come highly recommended, and I wanted to be a part of the best. The ability to just be able to take the courses that you need prior to being admitted into your core coursework for the program is just amazing, in my opinion, that I can decide that I want to choose a different career for myself, and I can do it in a year. You can't beat that.
I'm Kate Kirkland, and I am a Mercer University ABSN student in Atlanta, Georgia. I found out about Mercer while I was still completing my first undergrad degree in public health. Nursing was always the plan for me, but I ended up getting pregnant with my son when I was finishing my first degree, and I started researching nursing schools around here. I saw an ad for Mercer come up and put in my information, and I got a call from my advisor. I was in contact with her for about 2 years before I actually applied into the program. It was very, very impressive. I applied a lot of other places and I did not hear back from most of them. And with Mercer, I got a call from my advisor once a month. Before application, she was emailing me once a week, calling me once a week, and just always following up and making sure that everything was going okay. When I took my TEAS exam, she called me the day of to tell me what a great job I did and was just, my cheerleader the whole time, and that was something I really appreciated. The program is partially online and partially in person, and that works out very well with having kids and a life outside of school.
Looking at me, you could definitely see I am a non-traditional student, and that's okay. The first time I thought about pursuing a career in nursing was after I earned my undergrad, and my mother said, "You would make a good nurse," but I was like, nah. I want to do public health. I went and completed my master's in public health. So for 27 years, I worked in that arena. As I was working there, I realized there's this great connection between chronic disease, mental health, and coping skills. I want to have a holistic approach. I love what I did, but it was at the macro level. It was on the federal level. I want to do it one-on-one. The whole idea of preventing diseases is so much better than the curative piece. That's why I made the shift. I didn't retire and sit back and say, what am I going to do now? I put in place strategies so that I could retire early so that I could go into nursing. My goal is to be a mental health nurse practitioner. That's why I'm in nursing school, and that's why I know mothers are always right, because it took me 40 years to get here, but she was right. I saw Mercer, I looked into it, I knew they had an excellent program. From the moment I contacted Mercer, I just always felt supported. All of the professors, I just really enjoyed working with them. It was so nice to look and see people who look like me, also teaching the courses, so that helped a lot. I would encourage any other non-traditional student, someone who is older, to come on and to try it.
We have our groups for lab or clinical, so I've had a chance to develop relationships and friendships with the people in my cohort. And we have a group me outside of our Canvas course, and we'll post things in the group me, tips, other study materials that others found helpful. And then sometimes after the exams, we talk about the exams and questions we may have missed. Because for me, I'm an auditory learner, and if I hear someone else explain it differently than how I may have read it in the book, that's helpful for me. It is, and you have to be on top of your schedule. I'm an independent kind of person, so it's been fine for me to be at home studying alone.
I live an hour and 15 minutes away on a good day, but I like it because I can listen to my lectures, and sometimes my friend and I will call each other and we'll just keep throwing out questions throughout the time. And then there's people that live really close. So I just want to make it clear that it can work no matter what your circumstances are. It works if you don't live super close and you don't want to move into Atlanta.
I agree. But yeah.
But yeah, it's always there.
One thing I liked about Mercer's program is that it was 12 months. So it was the shortest program out of all the accelerated BSN programs. And that was one of the biggest things for me, because if I'm going to be sitting out of work, then I want to be sitting out of work for the shortest amount of time possible.
We have many people with many backgrounds, different ages, coming from everywhere in this program, and I think that's special because it's not like your typical program where you do 4 years and you're done. My friend has twin babies that are 2, and she's able to get through it. If you're going to do this program, you need to be dedicated to this program. It's very important, but it is definitely achievable.
The program is partially online and partially in person, and that works out very well with having kids and a life outside of school. I just feel very humbled and impressed to be part of the oldest nursing school in the state of Georgia.
Looking at me, you can definitely see I am a non-traditional student, and that's okay. You already know how to navigate life. You're just going to apply that here. All of the professors, I just really enjoyed working with them. It was so nice to look and see people who look like me, also teaching the courses, so that helped a lot. I would encourage anyone, any other non-traditional student, someone who is older, to try it.
This program is for people who already have a degree, and we already did 4 years in college. So the ability to just be able to take the courses that you need prior to being admitted into your core coursework for the program is just amazing, in my opinion, that I can decide that I want to choose a different career for myself, and I can do it in a year. But also, Mercer's nurses come highly recommended, and I wanted to be a part of the best.
Mercer has a lot of simulation labs and practice situations for us, for pediatrics and for basically everything. We always have at least one simulation lab for our classes, and they give us instruction on things that are good to do with patients, and that's something that we also read about in textbooks, is things that we can do with patients, interventions that we can initiate ourselves without a prescription from the doctor, things that we can do to go the extra mile for the patient to help them be more comfortable.
The first semester, we did a lot of virtual labs and in-person labs, and then we had not as long of a day of clinicals. And then we moved into our second semester, and clinicals got longer, so 12 hours. Everybody was so sweet. They have lots of different resources for us, and so it just fit for me.
Looking at me, you can definitely see I am a non-traditional student, and that's okay. I did not find it difficult to do. You go through the prerequisites, and the prerequisites, it's a blended program. So you're going to learn to use the Canvas environment. Your professors are there to assist you with that. You already know how to navigate life. You're just going to apply that here. I would encourage anyone, any other non-traditional student, someone who is older, to come on and to try it.